my name is Jerry Lynn, and today I'll be teaching you about ultrasound. For today's use, the diagnosis will be of a 24-year-old female with anterior tibialis tendinitis from 3 days ago running 1.5 miles. Before treatment, during the initial exam, I check for contraindications and precautions. Contraindications include malignant tumors and blood clots. Precautions include fracture or acute inflammation. Hence why today we are doing pulsed ultrasound because it has non-thermal effects. All of the parameters for this ultrasound session are based on the fact that the tibialis anterior is superficial and near a bone. Select ultrasound and the applicator that you would like to use. We are going to be using 3.3 megahertz, and always make sure that you're using watts per centimeter squared. The duty cycle is going to be 20%, and this is going to make the ultrasound be pulsed and ensure that there are no thermal effects. The intensity can be between 0.5 and 1 watts per centimeter squared. We will be starting with 0.5 to ensure that no thermal effects are felt. The time frame for this ultrasound session can be between 5 and 10 minutes. Today, I chose to use 8 minutes. Before starting the treatment, I will first conduct a sensation test to ensure that the patient can inform me if she feels any thermal effects. So, can you feel this?
Yes.
Can you feel this?
No.
Can you feel this?
Yes.
Can you feel this?
No.
Can you feel this?
Yes.
Good. So now I'm aware that the patient has intact sensation. Next, to find the exact area of pain, I will know my insertion and origin of the anterior tibialis, as well as asking the patient to actively dorsiflex and find the exact area. Is that your pain?
Yes.
Okay, so I will mark the area of treatment by using a landmark on the body like a freckle. I will begin the treatment by cleaning both the patient's skin and the ultrasound head with alcohol. Next, I will apply the ultrasound gel to the ultrasound head, making sure not to touch the bottle to the ultrasound head. I will rub in the gel to the treatment area so I know where to be working for the next 8 minutes. I want to ensure that I am continuously going in circular motions to not create thermal effects. Once I have this area created, I can then press start. Throughout the treatment, you want to make sure that the ultrasound head does not leave the patient's skin, otherwise the ultrasound crystals could be broken. Throughout treatment, check in with the patient to ensure that no thermal effects are being had. Do you feel this?
No heat.
No heat. Good. You can increase throughout the treatment time up to the 1.0 watts per centimeter squared, like discussed earlier. Now that the treatment is done, I can clean the patient as well as the ultrasound head of the gel. Make sure to clean the ultrasound with alcohol before placing it back with the machine. The benefit of today's ultrasound treatment was to accelerate the rate of healing by increasing cell membrane permeability. The outcome of this treatment is a long-term outcome. By accelerating the healing process, we subsequently reduce pain and allow the patient to return to running faster. Thanks, and hope you learned something.